Good morning, everybody. I'm Dr. Mona Ibrahim, a physician at Al-Qasmi Hospital, Sharjah, UAE. Today I'm going to present a small video about the fine needle aspiration biopsy procedure. Fine needle is a simple procedure and very safe, and it should be performed for thyroid nodules that are found clinically or incidentally during imaging in all high-risk patients, such as those with a history of radiation exposure during childhood to the head and neck, or if there is a rapid growth in a nodule, or if we notice hoarseness of the voice, vocal cord paralysis, or dysphagia. In those with a family history of thyroid cancer or Mann syndromes, also aspiration should be done. The ATA guidelines recommend the ultrasound-guided fine needle aspiration biopsy for all nodules which are more than 5 mm in high-risk patients, and in those with suspicious sonographic features, like those who have solid nodules, hypoechoic, if there are microcalcifications, if the nodules are with irregular borders, if there are central vascularity, or taller than wide nodule. Thyroid nodules of 2 cm size or larger should be biopsied. Those who have palpable lymph node as well should have a fine needle aspirations. For any nodule which is more than 1 to 1.5 cm with suspicious features, we should also do a fine needle aspiration. Mixed cystic and solid nodule with no suspicious features and more than 2 cm should have a fine needle aspirations, and also the spongiform nodules. Fine needle aspiration biopsy, as I said, is a very simple and safe procedure. It can be done in the outpatient clinic and doesn't require any advanced preparation. The tissue biopsy that will be taken will be sent for cytological examination. The fine needle aspiration can be performed with or without local lidocaine anesthesia. It is usually performed on the standard examination table, and the patient lies in the supine position. We should put a pillow under the patient's shoulder to allow for increased neck extension. For children or adults who are unable to cooperate with the procedure, sedation may be used. And we can use the ultrasound as a guidance for the fine needle aspiration if the nodules are non-palpable or technically difficult to aspirate, like those who are posteriorly located. The sample is taken by repetitive movement of the needle through the nodule. The needle is attached to a 10 ml syringe. The aspirated material is smeared directly on a slide, fixed and stained. The liquid, those who are collected, can be used in a liquid preservative, and a thin layer preparation are made. If the patient is taking drugs like aspirin or non-steroidal or clopidogrel, these drugs should be discontinued 5 to 7 days in advance to reduce the risk of bleeding, as they inhibit platelet aggregation. Anticoagulants such as warfarin can be discontinued also 4 to 5 days before the fine needle aspiration. But if this will place the patient to complications, we should not discontinue the drugs. But most of the clinicians feel that the procedure is safer when the international normalized ratio, the INR, is less than 2. The complications, though the procedure is very safe, but local pain and hematomas can occur. Sometimes a thyroid swelling transiently can happen. Infection, tracheal puncture, needle track seeding. Sometimes and very rarely, recurrent laryngeal nerve palsy can occur. The overall accuracy of the fine needle aspiration exceeds 95%. It is the most accurate method for evaluating thyroid nodules and selecting patients for thyroid surgery. The false negative rate of a benign interpretation is 0 to 3% only, and the positive predictive value of a malignant interpretation is from 97 to 99%. Thank you.